Good evening. Welcome to the Kelly Wright Show from the nation's capital here in Washington, D.C. And as we begin to look at today's news, we also focus on the news that everybody's talking about, coronavirus. And that is my opening observation. COVID-19, as I've stated before on this program, has caused a pandemic. And it's a pandemic of not only a deadly disease, but also disruption. Disruption, as I've mentioned, through the stratosphere. We're all finding ourselves socially distancing ourselves. But as I've talked about it before, let's not isolate ourselves from each other. Let's reach out and touch somebody through social media. Encourage one another. And that's the operative word as we move through this pandemic. We must stand together and we must encourage each other and embrace each other with faith, hope, and love. Against those three, and faith in God, nothing can prevail against us. Hope prevails against all. And those are my opening observations. And joining me now is Dr. Benjamin Chavis. He is a civil rights icon, as you know, but he's also head of the National Newspapers Press Publishing Association, I should say, the Black Press USA. He joins us now to talk about a very important thing that the black press is getting behind, and that is it's created a task force to tackle the issue of coronavirus and how it affects African American communities. Dr. Chavis, thank you for joining us today on the Kelly Wright Show. Tell us, if you will, what this new task force is going to do.
Thank you, Kelly. It's always good to be on your show. And this is a timely subject. The National Newspaper Publishers Association has established the Coronavirus Task Force and Resource Center. Our concern across America today is that African Americans are exposed to this deadly disease, but we're not getting a lot of the information that appertains directly to Black America. And therefore, we have 230 African-American-owned newspapers and media companies across the country. And certainly, always a pleasure to work with you and the Black News Channel and your program. So the purpose of the task force is to aggregate and disseminate information, vital information to Black America, not only about how to prevent from catching this virus, but if there's someone sick in your home, what to do, just facts. We're working with the National Medical Association, that's the Black Doctors in America, the National Association of Black Nurses, National Association of Black Law Enforcement Executives, and many others. I'm very proud that the NNPA, the National Newspaper Publishers Association, has taken this initiative.
As you know, some people might look at this on the surface of it and say, why is this necessary when everyone's impacted and possibly affected by the coronavirus? It affects us one and all. Yet I understand the premise of it all, and that is to reach out to a community that is often forgotten, especially in urban areas where there might be low income and they might not be getting the information or the help that's necessary.
Absolutely, and keep in mind, before the coronavirus pandemic, Black America was already disproportionately hit by respiratory disease. For example, in Harlem, 60% of all the children have asthma. So we are more vulnerable than other populations in America to the coronavirus. And from African American physicians I've talked to, they want to drive home this point, in particular among our millennials. You know, my son has this thing called Black Millennial Voices. We're also reaching out to young people.
Very fine, by the way.
Too many brothers and sisters out on the beaches and the clubs not taking this serious enough.
I want to drill down on what you just said because, to your point, Sheila Thorne, who's president and CEO of the Multicultural Healthcare and Marketing Group, LLC, states this, Dr. Chavis, and it's in the NNPA Newswire. It says, it is well documented that African Americans get sick more frequently, are screened for illness less often, are diagnosed for disease later, are treated less aggressively, and buried earlier than those in other ethnic groups throughout America. That is quite startling and, in fact, alarming, which is why I applaud the efforts of the NNPA and Black Press USA.
Yes. One of our publishers is Dr. Suggs, Donald Suggs, who is a medical practitioner, but he also owns the St. Louis American. The first person to die in St. Louis from the coronavirus was a distinguished Black nurse. And so Black healthcare workers are also disproportionately exposed And now there's a shortage, as you know, of masks. There's a shortage of ventilators. There's a shortage of protective gear, particularly for workers in the healthcare industry. And we are also greatly deployed on the front lines of this. And therefore, our combined efforts, I want to make sure we have an inclusive picture of how devastating the coronavirus is.
Welcome back to the Kelly Wright Show. We're talking to Dr. Benjamin Chavis, who is head of the NNPA, that is the National Newspapers Publishers Association, which is also the Black Press USA. I want to read to you now something that Congresswoman Karen Bass, who is the chair of the Congressional Black Caucus, stated in an article about the coronavirus task force that the NNPA has launched. She says, quote, "I applaud the NNPA for taking a leadership position to disseminate accurate and culturally relevant health information to Black Americans that will protect all in the community and save lives, especially those who are underserved and underrepresented." Dr. Chavis, what do you say about that statement from the chair of the Congressional Black Caucus, Karen Bass?
Well, we thank the Honorable Karen Bass and the entire Congressional Black Caucus for their support of the NNPA in this effort to alert, inform, and to engage our community, our constituency on this serious coronavirus pandemic. You know the slogan during police brutality days, Black Lives Matter. Well, all Black Lives Matter, and particularly Black Lives Matter during this pandemic. And unfortunately, a lot of the mainstream news, Kelly, seems to skirt. You hear very little about the impact of this disease on various ethnic communities. I think that it's a global pandemic, first of all, so all people are exposed. But here in the United States, I'm hearing from New York, I'm hearing from Jersey, I'm hearing also from the West Coast. In our communities, unfortunately, the mortality rate, if we're not careful, is going to be high in Black America. And because we are vulnerable, we're more vulnerable for pre-existing health conditions, diabetes, respiratory diseases, heart disease. Thank God a number of our people are living longer, so we have a large elderly population in Black America. So all these things make us exposed. But I also want to caution young people. We now know that someone under 18 passed in California, and now I'm hearing about young people in Maryland also who have passed. So I want to particularly appeal to African Americans of all ages, but particularly our millennials. Don't take this for granted. This is just not a disease for older people.
This is not a joke, and it's not a time to be defiant and deny what's actually out there. Don't deny the facts, and at the same time, have hope over the hype and fear over the and faith over the fear. And to your point, though, and to Congresswoman Karen Bass's point about underserved and underrepresented communities, on this program just yesterday, I spoke with two representatives from the San Francisco census taking, and they wanted to explain to me that the hardest hit area, or the people who are often overlooked, are those people in the Tenderloin district, which is of course a predominantly African American and Latino community, and it's underserved, underrepresented, and it's impoverished. So from that standpoint of even trying to get a census out and trying to do it through a smartphone app now, everyone's conflicted with how do they reach these communities. And to see the NNPA and Black Press USA stand in the gap and go out to tell people, be careful, this coronavirus is real, and telling the millennials to actually take heed to this. To me, it's very important to get this information out because it's culturally specific and it's truth illuminated. And so, Doc, to those, again, who would say, well, why are you making it all about Black America? Well, right now, for this segment, we are trying to talk to Black America to say, arm yourselves with knowledge and be prepared.
Absolutely. The mere fact and the reason that we have the Black News Channel is to bring culturally specific information. And in this case, this information will be life-saving. I just want to reiterate what Congresswoman Bass said. The life and death in our community can be determined by how much information we get, when we get it, and then we act on the information. It's one thing is to receive the information. It's another thing to act accordingly. Many of our states now are asking people to stay home, engage in social distancing, making the proper arrangements to make sure you have enough food to live, and family members. It was so tragic. You probably heard about it in New Jersey, where 4 to 5 people in one family died because they infected one another in their own home.
Yeah, and I believe that was a Latino family. Yeah, and culturally, they we all come together in our families. And to be fair, Doc, on this program, we've talked to a young lady from China who was talking about let's dispense with the racism. We talked to an Italian gentleman who was a reporter, and he was coming out of Italy and yet putting himself under a self-imposed quarantine once he made it into the UK. We've heard now that Prince Charles has tested positive for coronavirus. So to your point, we are trying to arm everybody with the knowledge that will safeguard their lives. And again, I appreciate all of the efforts of all of your reporters who represent the NNPA Black Press USA.
Well, thank you. We enjoy working with you. We're going to continue to work with you. And we're going to be sending out daily alerts about the coronavirus to all of our people across the country and also internationally. Thank you so much, Kelly.
Thank you, sir. And we stand at the ready to assist you and to help you, not only through the Kelly Wright Show, but also on the Black News Channel. My guest, Dr. Benjamin Chavis of the NNPA Black Press USA. Thanks again, Doc.
Thank you. God bless.
God bless you too. And we'll be back with more after this. Welcome back to the Kelly Wright Show. I'm talking to Dinaj Edmond right now. I'd like to introduce you to her. She is an incredible young woman who's facing some difficulties because of this COVID-19. Dinaj, what is the problem? I was noticing on your Facebook post, and it alarmed me that you were dealing with COVID-19 and the aftermath of being told that your business was shutting down and that you would no longer have health care. Why has that caused you so much anxiety?
Well, it caused me a lot of anxiety because for last week and the beginning of this week, we were all given kind of false hope that we were going to be taken care of, that we didn't have anything to worry about, and that our company was working on a plan to pay us for up to 10 weeks. So we were under that false pretense that we were going to be taken care of, and we were kept at work under that. So it wasn't until Monday, 4 p.m. that we were given this letter stating that at 5 p.m. we're being let go. And so it was really, shocking.
Now that's from Silver Spring. What company is that in Silver Spring, Maryland?
Coons Ford of Silver Spring.
Okay, which is a car dealership in Silver Spring, one of the most popular car dealerships throughout the Washington, D.C. area. So when you received that was quite startling at best. But then you had another issue, a health issue, and
go ahead.
Oh, and one of my questions that I immediately brought up was what's going to happen with our health insurance. And I was immediately told that our health insurance is good through the end of this month. So it only gives us a few days to get whatever we need medically. And for me, that is where my anxiety really set in, because I have an autoimmune disease that I don't share with a lot of people. So a lot of people don't know that. And you couldn't tell by looking at me that I actually suffer from an autoimmune disease. And it set in really hard for me because every 8 weeks I go through an infusion. It's kind of labeled under chemo, and it's kind of what helps keep me going, as well as taking these 8 pills once a week of a low dose chemo drug. And not having access to those is really what hit hard for me, because this infusion treatment that I take, it's like a $5,000 treatment every single time I go.
Wow, that is quite alarming. Now, you used to work in broadcasting as well. I recall your days working at Fox and NBC and doing so much great work as a producer, and then you transferred out to the car business. But that hasn't caused anything like right now with this coronavirus, this COVID-19 pandemic, the unemployment you're encountering, and not having health insurance, having that taken away. What's your dilemma, and what will you do about it?
Well, my dilemma is nobody planned for this to happen. This is unexpected, and it's heartbreaking because when the reality sets in that there is no income coming in, there is no health insurance. It's like, what do you do? And I had to take the moment to cry and acknowledge, because I think it's important that when things like this happen, we take that moment to acknowledge, cry, whatever we need to do. And then it's all about, okay, now what am I going to do about this? What options do I have? And my only thing was to share this, because I feel like there's so many other people that are going through this. And I know that I'm not the only one. And that's why I felt like I needed to share this, because a lot of people that I know so many people, but a lot of people don't know that I've had to deal with this illness for the past 4 years, that I've silently dealt with this, but when it comes to the point where there's no more health insurance, my medicine runs out. There was a time before I was diagnosed where I could barely walk. I could lift anything. I could barely hold anything. I could barely even open a bottle of water. It was that painful, and I don't want to ever experience that again, because I know what that felt like.
And Dinaj, I'd like to continue the story with you. We got to take a break for one moment. Would you stay with me and come back so we can talk about your story and how this entire pandemic is causing problems not only for employers but for employees like yourself? And perhaps we can try at best to get people to be aware of your problem and the problems that so many people who are remaining in silence, the problems that they're encountering. You're echoing the voice for so many people in America. Stay with us. We'll be back in just a moment with the Kelly Wright Show. Welcome back to the Kelly Wright Show. I'm talking to Dinaj Edmond, I should say, and I was actually reading her Facebook post last night, and it appeared here, and what Dinaj was talking about was how her reality set in deep as she began to cry after being laid off from work. She was just talking about that in the previous segment. And Dinaj, you were telling us that you suffer from an autoimmune disease that is causing a lot of problems for you. You can't even open bottles sometimes if it isn't treated. And is that the inflammation that flares up in your disease?
Yes, it is. And the really great thing about having health care is that I had access to infusion, which definitely helped with, alleviating the pain, alleviating any inflammation that I've had. And once healthcare and once the medicine runs out and I don't have access to that, I will go back to the beginning of this phase of when I couldn't open a bottle, I couldn't barely walk, I couldn't even drive without hurting, and not being able to walk.
First, I'm really sorry that you're going through this. I think a lot of people are not aware of some of the health abnormalities that people have and the concerns that they have in the wake of this pandemic. And certainly it's why Congress is trying to do something. It's even why the President of the United States was talking about what's happened to so many people is not their fault. This is a dreaded disease that has come into our country. And it's an opportunistic disease that disrupts everybody's life. Your life is now upended Do you think the actions by Congress, the money that they're putting out, will help you in any way? Will it provide some of the health care that you need in order to get the kind of prescriptions that are so important and vital to your health?
I think maybe it'll help some people, and I think that companies have the opportunity to do the right thing. In this case, in my case, I don't think so.
Do you have any hope at all that you can get through this? This is a very difficult thing, and if you don't think that Congress can help, and that companies can help, and that healthcare professionals can help, where do you find the help?
Well, I think, for me, um, my sisters have really helped me since last year. It'll be June since I've been on this whole program. My sister, when I finally opened up about what was going on with me, because like I said, this has been very private for me, because I've always been the one that's always there for everyone else, helping people and making sure everyone's okay. My sisters noticed something was wrong. I couldn't lift my arm. I was in pain. And so my sister, Miss Rock, she said, this is what we are going to do. We are going to eliminate sugar, starting, changing my diet, eliminating sugar, salts, and taking a grasp of my health, using different things like ginger, turmeric in my diet, eliminating, dairy. I didn't really eat, dairy to begin with, but eliminating all of those factors have really helped me in a lot of ways. And I feel like, you know, using natural medicine, using things like that, that is what's kind of helped me this past year.
So you're becoming proactive about your own health, but one can understand why you're upset with the fact that your health care is being stripped from you in a matter of weeks. And do you see any solution to someone coming in to provide you with the kind of adequate coverage, healthcare coverage, in order to get those prescriptions that you need?
Well, one of the things that a friend shared with me yesterday was being able to sign up for the Affordable Care Act, like on the which is being opened up for people who have been affected until the 15th of April. So that's one thing I was not aware of, and I am now, and I am being proactive in signing up for that, as well as now having to sign up for unemployment. I've never had to do that in my life, and
Right.
a lot of new things that we're being faced with.
Well, you are going to be covered by this new act that's coming out very soon with the CARES Act. I should ask, are you optimistic about the future?
Oh, absolutely. I mean, the thing is, one of my sisters last week, when I told her I was scared, one of the things she always reminded me was about God. And she said, you believe in God. God and fear cannot work together. you
Mm.
know
Mhm.
so from that, I take that every time that I feel anxiety, I acknowledge it, but I also pray and I thank God, and I just say thank you, God, every time I feel myself becoming overwhelmed, because we all are becoming overwhelmed with this. But the thing is, you have to have faith. You have to have a belief that things are going to get better, and I know they are. I mean, I have a positive outlook on a lot of things in life, and even with this illness, having the opportunity, having my sisters teach me different things, to take control of my health, and that's what I'm doing. And I do, yes, I am optimistic about the future. We are going to get through this, and we are going to come out, great. But a lot of people have to take this seriously, that this is not a game. This is not a time to be defiant, that when they tell you to stay home, stay home. Don't be selfish.
Denaj Edmond, I thank you so much, and I thank your sisters for showing you a lot of sister love and family love at a time that is actually a crisis for you, as well as for all of us. But you've brought us some new information that has shed light on the problems that so many people who have all kinds of illnesses to battle, and now this coronavirus that's causing so much disruption. But thank you for being optimistic, even in spite of your circumstances and against all odds. You're holding on to faith, as you mentioned, in God. And perhaps it's quite true that he can help us better than any band can. So Dinaj Evans, thank you for joining us on the Kelly Wright Show. Praying for you always. And stay in touch with us. Let us know how you're doing. And let us know if we can help in any way other than getting your story out. If there's something that we can do, we're here available to do that for you.
Thank you so much.
All right. And we'll be back with more after this. Welcome back to the program. Joining me now is Dr. Peterson Pierre. He is a dermatologist in Thousand Oaks, California. Doc, good of you to join us today. And the situation is in California, how dire is it? We keep hearing stories about how everything is shut down and locked down.
Well, hi, Kelly. Thanks for having me back on the show. Yeah, well, the situation in California, I don't know that I'd necessarily use the word dire.
Okay.
But we're definitely on lockdown. Pretty much enforced quarantine for the foreseeable future. We're hoping it's going to be only 2 weeks, but I think it's a situation that's pretty much evolving on a daily basis. And so as they get more and more information, they're trying to make the best decisions possible. But it's basically shelter in place. Now, that doesn't mean that you can't leave the house to go to the grocery store, to go pick up your prescriptions at the pharmacy, to go see your doctor, but certainly no large gatherings of more than 10 people. Don't leave the house unnecessarily, just those sorts of things.
Are you at all concerned that once we do start testing more people, we will see more cases?
Absolutely. I mean, I think if we think about it, right now, we have a low number of cases because we have limited access to testing kits. Once we have more testing kits and we test more people, naturally that number is going to increase. That doesn't necessarily mean that the situation's getting worse. All that's telling us is we have more data. And that's something we're going to have to track over time to really monitor what's going on with the infection as far as people who are getting sick. As far as right now, we're pretty much primarily testing people with symptoms. Obviously, this doesn't tell us about all those other individuals who don't have symptoms but may be positive.
So we've heard time and time again, this is why it's so important to socially distance ourselves, because that will help mitigate the spread of the coronavirus and flatten the curve. What's your best advice going forward? Some people are basically so tired of this disruptive disease, it's disrupting their lives, and now they're in high anxiety and stress. How do you allay their fears and provide them with hope?
That's a great question. So I think primarily we need to put this in perspective. Number one, we know that a large number of people who get infected will either not have any symptoms or will have mild symptoms and will recover without any medical intervention. Number two, people who do develop symptoms should definitely contact their doctor, either remotely through telemedicine or call their doctor and make a visit and then get tested. Once they're tested, depending on the severity of their symptoms, they may be able to be managed at home just with a little bit of isolation, or if they're more severe, they'll be in the hospital. Number three, there will be a certain number of people who will die from this disease, as is the case for many infectious diseases. Do I expect millions and millions of people to die? I don't expect that. And I'm basing that primarily on what we've learned from China and Italy. Now, there are a number of people, of course, who will die, but we're not talking about the vast majority of people. Ultimately, all we can do is follow the CDC's recommendations, basically social distancing, washing your hands, far more effective than using the sanitizer, avoiding touching certain areas. And I agree. I think this is very frustrating. It's very disruptive. And I think one of the things that causes people the most anxiety is the uncertainty. So if you're quarantined and you were quarantined for 2 weeks, for instance, as my daughter said, one of the most frustrating things is she can't even start to count down yet because we don't have a specific endpoint. And that, I think, is what's causing a lot of anxiety. But pretty much at this point, it's taking it day by day, trying to stay positive, engaging in activities at home that maybe you've been putting off for a while, and now all of a sudden you have time to engage in those, reconnecting with those in your own household. I mean, a lot of times we're just running around. We don't really spend quality time with our loved ones. This is an opportunity to do that. As you mentioned earlier, reaching out by phone, connecting with people you haven't spoken to for a while. One of the things is, we're all facing this situation together across the country, across the world. We can learn from one another. There is, unfortunately, some negativity that I hear out there on social media, as there usually is. I think shying away from that and focusing on the blessings that we still do have can certainly help to uplift our spirits while we wait for the end.
Doctor, that is a fantastic send off to us. We appreciate you saying that, coming from California as well, where a lot of people are watching that state very closely, as they are with New York and Washington State. All of our best prayers to you, and thank you for joining us to, especially introducing us to that new acronym, MEN. We appreciate you so much for that, Dr. Peterson Pierre from Thousand Oaks, California. Thank you, sir, for being on the show.
Thank you so much for having me, and I wish you guys the best.
God bless you.
God bless you.
And back with more with the Kelly Wright Show after this. Welcome back to the Kelly Wright Show. My first guest today is Laura Contreras-Rowe. She is a magnificent real estate agent for RE/MAX, and you might wonder, why would I bring a real estate agent on? It's because of, in this age of COVID-19, the pandemic is causing each and every one of us to actually shut our doors and not conduct business as usual. Laura is here now to tell us how she's conducting business in a very topsy-turvy world where everything is turned upside down because of COVID-19. Laura, thank you for joining me on the Kelly Wright Show. How has this COVID-19 pandemic affected you and your business in real estate? And I should mention that you're down in the Virginia Beach, Virginia area, which is a hot area.
Yeah, and Virginia Beach, Virginia, this whole area, actually, Kelly, we have 5 military bases here. So for real estate, we've always been on the go. Like, I don't think we've really had a big, what do you call, like a separation where there's not a lot of business, because every 3 years, the military is always being moved. And so I think for the agents that are full-time, because you have full-time agents and then you have part-time agents. For the full-time agents, I think we had enough. Well, for me, I had enough in my pipeline. And I think that's super important, to have business in your pipeline. So I see a little bit of it, tapering off a little bit. One of my clients was supposed to come down this weekend. She decided not to come because she has a hair salon. They were doing a high volume per month. And now, as you know, since they closed down, she won't be able to make it this weekend. But the good news is that she still has to move here. So that's the good news. She's definitely coming. It's just a little bit of a delay,
So the COVID-19 causes delay, but not denial of your business transactions. Is that what you're saying?
Right. And like I said, as a full-time agent, I have houses in my pipeline. I think this past week I put 4 contracts four properties under contract. One actually did fall through, but that was a short sale. That's a different story. But I'm expected to list about 3 or 4 in the next 2 weeks. So that's still really good volume. I did some numbers just so I can tell you what we're seeing here. It's still an interesting market.
It's like a market
Analysis of what's going on in your region.
Yeah, it's just so interesting. I mean, look, even as of the last 7 days here in the Virginia Beach, Hampton area, we've had 1,033 new listings. Okay, we've had 92 come back on the market. We've had 400 with a price decrease. We have 808 pending. We have 639 that sold. We have 162 that were withdrawn. Now that's an important number. And then we have 62 with the price increase. Now that's in the last 7 days. You're looking at over 3,000 transactions has either come and gone in the last 7 days. That's still to me, that shows that the market, our inventory in our area is so low. So it depends on what part of the country you're on. Some countries, some part of the countries don't have a high inventory and a low inventory. So I believe that we're still running a low inventory from the original crash. So I kind of feel like that's kind of, these numbers are proving that at this point.
So how do you encourage people beyond the real estate market? Because in selling real estate and marketing real estate as well as you do, I also know that you're in touch with the human soul of it, if you will.
Yeah. It's interesting. We have a Nextdoor app, and I want to just tell the story really quick. It's called Nextdoor, and I'd seen where a lady had posted that she needed toilet paper, and this was probably about 4 or 5 days ago. I just happened to have gone to Lidl in our area, and they had a big thing of toilet paper. So I just grabbed it, threw it in the back of my truck, covered it up, back of my car, and covered it up. And I'm like, hey, it'll come in handy. Well, when I saw her post, I was like, I'm going to deliver toilet paper to her. So I went ahead and I got in touch with her. I didn't leave her 2. I left her 4 rolls, and I put them in plastic with gloves, and I had my sanitizer, and I just made sure that the toilet paper was clean. And but what's so interesting that day, Kelly, people, I almost felt like it was a little bit of shaming there. They're like, hey, why don't you go up to the store? This store had it. This store had it. Some guy said, I just got back from out of the country and I saw it at this store. And I think they're missing it here.
They're missing the point. Yeah.
It's crazy. She didn't say, I don't have a car to go get it. She said, I need toilet paper. It could have been that she was laid off that week. It could be that she was on her last $20 because, as you know my backstory. I grew up in a trailer my whole life. I know what it looks like. And it really just it made me emotional because something so simple as toilet paper. So I delivered, apparently another person delivered toilet paper to them, which is awesome. But you got to understand, it's like, I think people just need help, Kelly. They don't need you to give them an opinion. And it just made me crazy. So I'm glad I can at least tell the story. I don't know who she is. I'll never know who she is. And it doesn't even matter to me who she is.
Well, thank you for sharing that. And thank you for sharing a basic need like toilet paper with a neighbor, a stranger to you, but yet someone who was in need. And in this age of socially distancing ourselves, you didn't isolate yourself from meeting someone's need. Laura, stay with me for the next break because you're also the wife of an Air National Guardsman. You're also a mother of 2 amazing young men. We want to talk about how you're facing this COVID-19 pandemic with your motherhood and being a wife, helping your family as well. Back with Laura Contreras-Rowe in just a moment. Welcome back to the Kelly Wright Show, where I'm joined by my guest, Laura Contreras-Rowe. I should point out that I've known Laura for a number of years right now, and I know that she's been a very charitable person who has her own charity organization. She is also an author and speaker, and she is a real estate tycoon, if you will, there in the Virginia Beach area. And I thought it would be important to have her on today to not only talk about the real estate market and try to help people through that in terms of finding their homes or renting their homes, but also to talk about her role as a mother and as a wife. Laura, you are the wife of an Army National Guardsman who is going to work right now. He has an essential role to play in the state of Virginia, where Governor Northam has caused that state or asked that state to go into a shutdown status. Schools are closed there until the end of the school year. It's a very serious situation there in order to mitigate this COVID-19 and the spread of it, to flatten the curve, if you will. What's your role as the wife of someone who is in the Army National Guard?
Yeah. And I'll just to let you know also, so during the week, Keith actually works for the Air National Guard, and he's actually one of the maintenance guys because he's head of the maintenance facility for Red Horse out here in Virginia Beach area. So yeah, he's still going to work because I believe for Keith, he doesn't really come in contact with anybody. He basically helps if anything's wrong, lights are out, there's issues with the facilities. We're still trying to get in, and it is the Air National Guard. So he's keeping them straight.
So he's actually working maintenance with the Air National Guard, but also serves in the Army National Guard. Yeah. Well, we thank him for his service double.
Yeah. So, and as far as the Army, I know that he told me that drill was canceled. So he was supposed to have drill. I don't remember if it was this weekend or next weekend. So they put all them on hold as for now, but he is always getting briefed. He's constantly, they're constantly keeping him in the loop. I'm probably not in the loop as much because a lot of stuff's going on between his unit. But right now he's good. I mean, right now they haven't asked him to go anywhere. And so for now, that's good. That's good news for us.
And then your son, Austin, is an award-winning photographer. How has this COVID-19 impacted his business?
Yeah, he's doing good. I mean, he works, he is a cinematographer and he does a lot of stuff for his company, photography. And he works for Ironclad Media Alliance. And he's actually in earshot of me. He's right there with his Macintosh, and he does a lot of editing. He does a lot of social media for Ironclad, and he does a lot of stuff for the company. So at this point, he's just working from home. I don't think they have any out-of-town shoots. He usually travels all over the world with his company. And for now, I think they're on lockdown for traveling for a few months.
Well, Laura, I would be remiss if I didn't mention the fact that you are the author of a great book that's an award-winning book called Aim High, Be Extraordinary. The story is about amazing Latinas. You are a woman of color. What's your message to not just women of color, but women around the world as they deal with this COVID-19 pandemic? How do you keep the hope and faith alive?
I just think we have to really draw on our faith. I think God has not given us a spirit of fear. And I think we have to constantly remind ourselves of that. And it's amazing how many people are so fearful. I've got friends and some colleagues that won't leave their house because they're so fearful. And all I would say is that, you really need to trust in the Lord. I think we need to be smart, but I don't think we need to be fearful, because I do believe that that's the enemy in my opinion. And I just think that, just being, it's amazing, Kelly. I walked the dog the other day, which I haven't done in a long time because I haven't been here. And it's amazing to see the families outside. So I really kind of think this is such a blessing in disguise. But I think when I see families walking out, and it just brings hope. One of my neighbors came over the other day and she's like, "Thank you so much for keeping your Christmas lights on."
Oh, wow. That's good. That's good.
It's not like I didn't mean to leave my Christmas lights on, but we just bought a new house. And it's they're icicles, and we just never took them off because we have a big property and it's dark and I don't like that. So she thanked us for giving hope for the neighborhood, which I thought was so cool. But going back to that, Kelly, I really think that, you need to listen to uplifting music. If you can do worship, if you can listen to, uplifting music, I think you should keep your TV, and I hate saying it, at a minimum, because we can watch TV and then you just think the world is falling apart. But the minute you walk outside and see, today it's raining, but tomorrow will be 70. And it's like, it brings hope. And I brought my flowers from outside so I can, so I planted 100 tulips. Looks like I did okay. But, I think that's the way to do it. I think we have to keep our mind in check. And if we keep our mind and our heart in check, I think really God can do amazing things during this time.
Well, I appreciate you joining us on the Kelly Wright Show, and it's good to hear your hopeful response to things that are going on. And in this day and age, we could actually bog people down with all the negative news about COVID-19, but it's also good to lift people up, and that's what we seek to do here on this show, to inform and to inspire. And you certainly brought that to us today. Laura Contreras-Rowe, thank you so much. We'll have to have you back, especially when we get beyond this pandemic. God bless you.
All right, Kelly, thank you.
Okay. Back with more of the Kelly Wright Show right after this. Don't go anywhere.
Precious Lord, take my hand, lead me on, let me stand. I am weak, I am tired, and I am lonely.